Спасибо большое. Ольга Манухина, она как раз вот презентует нам ту программу, которая была реализована уже, да, и расскажет вот по направлению табакокурения как раз.
Good morning, everyone. I prepared my presentation in Russian, but it seems that the majority of our participants speak English, so I will try to speak in English, and I will be rather brief because you already touched so many items that the WHO is dealing with. So let me just summarize what we already discussed, and maybe I will also give some new points. So when we start our discussion regarding tobacco control, there are several points that's really important to remember and to know about tobacco. So smoking is the single fully preventable cause of death in the world. And the only, I would say, party that is responsible for the tobacco epidemic is the tobacco industry. Every year, tobacco kills more than 7 million people in the world. And in the 20th century, more than 100 million people died due to tobacco consumption. And currently, we have more than 1 billion people who smoke in the world. The good news is that we have really effective measures that can control tobacco consumption, but we need to accelerate their implementation for sure. So what is the tobacco? Tobacco is a really special and I would say unique product. It contains nicotine that is addictive. And it contains more than 4,000 chemicals that are really harmful, and more than 50 of them are really cancerogens. And this is the only legal product that can be bought by consumers and that kills finally half of their consumers in the very end. And you can buy it almost everywhere. Tobacco, as it already was mentioned by Luigi, it's the main risk factors for non-communicable diseases. Here you can see the risk factors that are tobacco control, unhealthy diets, lack of physical activity, and alcohol consumption. And you can see that, for instance, I just cannot point it, but tobacco consumption is responsible for development of all types of chronic diseases, including diseases of respiratory system, cancer, cardiovascular diseases, and diabetes. And that's why we can say that tobacco control is a really prevention of cancer. Because every year tobacco consumption leads to 1/5 of all causes of death from cancer in the world, and it's the most considerable risk factor related to cancer mortality in the world. And it's already mentioned how many types of cancer tobacco provokes. And here you can see just this picture. And the most famous correlation that it's really, I would say, like evidence-based is that tobacco causes more than 70% of cancer of lungs in population and almost 90% among male population. And we shouldn't forget about the secondhand smoke. What is the most important, that there is no safe level of secondhand smoke. And it affects all groups of population, including babies, including pregnant women and adults. So the only measure to control it is the full ban of smoking in public places that we already discussed. If we talk about tobacco prevalence globally and in the European region where Russia is the member, we can see that in Europe is the first line that it's in red, and so you can see that the European region is famous for the highest level of smoking prevalence among adults in the world, and the same highest level of smoking prevalence is among women. So it's not much to be, I would say, like happy with. Regarding the global burden of mortality related to smoking, we also can see that tobacco contributes mostly, and it's even more death compared to malaria, HIV, and tuberculosis together. And as Irina already mentioned, the really nice news and the information that we have a very effective tool. It's called the Framework Convention on Tobacco Control. This is the global treaty that was developed by the WHO, and it came into power in 2005. And now we have 181 states that are members to this protocol, and Russia is among these members. And this is really powerful instrument that helps countries to fight tobacco. And on the basis of this treaty, WHO developed a famous package that it's called WHO Empower. This is the most effective measures that, if they implemented all together, they provide great results. So here you can see such measures as monitoring. So it's really important to monitor smoking prevalence in the country. Then it's protects. It's about the protection of people from tobacco smoke, and mainly here we talk about the full ban of smoking in public places. Then it's offer help to quit smoking, and here the main role belongs to the Ministry of Health. Then it's warn about the dangers related to tobacco smoking, and hear about the raising awareness of population with regard to harmful tobacco use. Enforce means that we need to introduce full ban of advertisement, sponsorship, and stimulation of sales with regard to tobacco products. And the last one is raise taxes on tobacco. This measure comes like in the end, but I would say that at the population level, this is the most cost-effective and efficient measure among all the mentioned. If we talk about tobacco control in the Russian Federation, this issue was also raised by Irina, and really proud to have the comprehensive tobacco control law that was adopted in 2013. And I would like to add that it came into force in 2 steps. That's why the population was prepared. So some measures were introduced in 2013, and others that were related to the full ban of smoking in public places came into force in 2014. So we had 1 year to adapt all the current situation to the new provisions of the law. And we saw that that this legislation really is working, and we have the evidence of it because in 2009 and 2016 we conducted 2 rounds of the global adult tobacco survey. Its abbreviation, it's GATS, and this survey showed that for the period since 2009 to 2016, the relative smoking prevalence decreased by more than 20%. It's huge and tremendous figures, and the reduction among men was approximately 16%, and among women more than 30%. And if to talk globally regarding tobacco control, I would like to mention that fight with tobacco is one of the key global targets related to NCDs, and that should be achieved to the year 2025. And here we have the target to reduce tobacco consumption from the current level by 30%. It's really ambitious, but we hope that in some countries we will be able to achieve these results. And also I would like to remind you about the really important day in the year that we have every year. It's 31st of May. This is the World No Tobacco Day. It was established by the WHO in 1987. And its aim to attract attention of mass media, of policymakers, of all groups of population to this important global health issue. And every year there are different themes of this day. And here you can see, for instance, in some years, the topic was like raising tobacco taxes. Another one, it was like countering tobacco industry interference, then regarding plain packaging. And also the previous year, 2017, we had the topic of like tobacco is our common enemy. And in this year, we had the topic related to cardiovascular diseases. And what is also help us and can help all of us to fight with tobacco control is global sustainable development goals. I hope that you heard about them. They really cover all aspects of sustainable development in each country and population of the world. And all countries committed to achieve these targets and these goals by the year 2030. And among these goals, we can see the goal number 3 that relates to good health for everybody at each age. And among the targets within this global aim, we can see one related to decrease of premature mortality from cardiovascular diseases and acceleration of implementation of the Framework Convention on Tobacco Control. So at the global level, we have really effective and great tools to fight with tobacco control. Thank you very much.
Да, пожалуйста, у вас вопрос.
In terms of illicit protocol, unfortunately, Russia hasn't signed it. I know that the process in the parliament and the government authorities is going on, but as it relates to literally to all, I would say, branches of the governments, this process is really long, but I hope that finally this protocol will be signed by the country.
In terms of Article 5.3, have any special measures taken?
This topic is also under development for many years, and I would say it's not like something that's implemented by the law for this disclosure of the interactions with the tobacco industry, but it's now it's delivered in a sense of like it's goodwill for the government authorities to disclose their relations with the tobacco industry, but we are aware that in many cases, unfortunately, it doesn't function, so some more strict measures should be done in this direction.